This is PT Pro Talk, the podcast for physical therapists who want to improve their clinical skills and be more successful. I'm Mariana Parks, physical therapist and your host, and today I share my conversation with Tom Goom, where we discuss training fundamentals for treating injured runners. In our discussion, Tom will cover key principles of training and recovery, focusing on consistency, recovery, fueling, volume, intensity, and more, especially for those returning from injury. Integrating rehab and cross-training, so practical strategies for incorporating these elements into weekly plans and treatment approaches for optimal results. Addressing pain, injury, and gait, so insights on managing pain and the most common running injuries. And collaborating with running coaches, exploring how working with coaches can improve patient outcomes. Tom is a physical therapist with over 20 years of experience, researcher, and keen runner. He specializes in running injury and has published in tendinopathy, running, gait, and athlete empowerment. He also features regularly in mainstream media such as Runner's World. Tom presents his running repairs course internationally and online, and his website running-physio.com has gained a worldwide audience to become a go-to resource for many runners and therapists. If you find our conversation informative, please subscribe to our channel, hit the notification bell for updates, give us a thumbs up, and share this episode with colleagues who might benefit from these insights. Thank you for tuning in, and let's dive into the discussion. PT Pro Talk is only possible with the support of the forward-looking and innovative companies like
Welcome to Urban Polling. Discover the Activator program and polls for rehab and balance.
Sarah Health. Have you heard of remote therapeutic monitoring? Does it sound complicated and hard to implement at your practice? It doesn't have to be. Sarah Health is revolutionizing RTM, making it straightforward for your practice. From easy onboarding to hassle-free billing, they cover it all. Hi Tom, welcome to PT Pro Talk. How are you today?
Hi Mariana. Yeah, I'm good, thanks. Thank you for inviting me.
Also, so let's get started talking a little bit about yourself and your career.
Yeah, so I've been a physio now for about 22 years, and I've been interested in running. Well, my whole adult life, really, I've been a runner, and then I started to specialize in the management of running injury about 12 or 13 years ago now, and really focusing on that area, combining the passions together.
That's great. And I know we were chatting a little bit before, talking about the training planning for runners when they're returning to run after an injury. So what would be some of the fundamentals of this training planning for runners?
Yeah, that's a great question. And I think the reason why this is so key is because we think most running injuries are probably linked to training error. So they're doing something in the training that's a bit too much for their body to cope with, and something becomes overloaded and painful. So this is why I think it's important as health professionals to understand it, because we want to guide them back afterwards, perhaps alongside working with a running coach. But yes, so the fundamentals, I often think there's three things we want to get in place first in terms of training are consistency, good recovery, including sleep, and sufficient fueling. So these are the big foundations, because once you have those things in place, then you can look at adding more. But without those, it's very hard to focus on, say, intensity or other aspects unless you've got those things in place first.
Yeah, and that's the bottom of our pyramid, right?
That's right. So we talk a bit about this idea of a performance pyramid, and that is the base of the pyramid. It's the foundation of the pyramid on which everything else is built. And perhaps just to expand on it a little bit, when we're talking about consistency, we see in the literature that like world-class runners often train for about 8 to 10 years before reaching international levels, systematically for that period of time. Now, we're not expecting our runners to do that, necessarily. But what we want is regular running at a manageable level. And as a simple goal, I like to get my runners up to about 3 runs a week of about 30 minutes before we worry about adding anything else in, because then we've got that consistent running with recovery planned in. So we've got rest days, we've got recovery weeks, we've got good sleep and enough fuel to meet the demands of their training.
Yes, and then when you talk about fooling, what would be the appropriate source of fooling?
Now, this is another area definitely, like I said, with training plans, we'd work with a running coach. With fueling, if you've got any concerns about an athlete's fueling and whether they're meeting their energy needs, I would tend to refer them to a registered dietitian who's got experience in that area because it's complicated. We've just seen just published some great research by Dr. Kristen Whitney that showed that low energy availability, so when people aren't fueling enough, actually impairs running performance and it may increase injury risk. And that's why it's so important. Now, Dr. Whitney shared some general tips. She suggests that runners, they don't skip meals. They focus on having 3 good meals a day and at least 2 snacks. And they try and make sure that their diet's rich in all kind of nutrients they need. So that the carbohydrates, the fats, the proteins, the vitamins, vitamin C, D, etc. But that's the general tips. I think if you're not sure, refer on to a registered dietitian or nutritionist.
Yes, and that's a good topic. I was having a discussion in another podcast, and oh my gosh, I'm blanking on the name. And he was talking about carbohydrates and the as a fooling, and discussing that even fat could be a good fooling. I mean, he's a doctor. I know it's not our area.
No.
The sports medicine doctor. Oh my gosh, hold on. I'm gonna remember.
It'll come to you.
Yes. He wrote the sports medicine book. So that was very interesting because he's like a regular person that runs a marathon. Like, hold on, that's not a regular person. Dr. Peter Bruckner, yes.
Oh, of course, from Bruckner and Kahn. Yes, absolutely.
Yes. So he was talking about that. That's so interesting. We have to maybe bring him back to discuss that in more detail. That was very interesting. He was mentioning he's all about cutting all the sugars and stuff, even for athletes. So that's for sure an interesting topic to debate.
So yes, on the topic of that, of course, I mean, we always bring it back to injuries, don't we? That's because that's our main role. And if you look at the Whitney et al. Paper, I believe what they found in female runners with low energy availability, they have, I think 51.7% of them picked up essentially an overuse injury in the training, compared to 7% of female runners who didn't have low energy availability. So that's quite a big difference. And it's hard to establish cause, but it makes us think, okay, this seems to be affecting performance and health. Lots of health factors are affected by low energy availability, and it seems to be affecting injury. So that's why I think it's got to be there at a foundation alongside consistency and recovery, I think.
Yeah, just a few things that we can pay attention as physios, right? To see if they are good on those areas.
Absolutely.
And then let's move on the pyramid. Anything else about those 3 things: consistency and recovery and fueling?
No, I think we've covered the key things. Our main source of recovery is sleep. So making sure people prioritize sleep, and sometimes people will want to sacrifice sleep to put more training in, but it's something that people have to weigh up. Is it going to be beneficial for me to get up super early and train and sacrifice my recovery? So this is a kind of thing we want to help runners understand that actually that may not be the best for them if they're already very fatigued. But the next step on the pyramid, the next thing that's important is training volume. So how much people are doing. And the reason why we think that is because it seems to be quite linked directly to performance. So there was some recent research, a big study of actually about 120,000 marathon runners based on Strava data, found that those that got the best marathon times were the ones training with the highest volume. So they were doing the most in terms of volume, and the majority of their training was low intensity work. So that's the next step. Once you've got that consistency, the recovery and fueling, that allows you to do bigger volumes, and that then will help boost performance. So that's typically the next step on the ladder. Now, in terms of how much you do, that's going to be very individual specific, and we'd still encourage people to increase gradually. But for me, that would be the next priority on the list.
Mm-hmm. And then zone 1 would be related to speed for the ones that don't know that.
Yes and no. So in that particular paper, they divided it into 3 zones. So zone 1 tends to be below the lactate threshold. So it tends to be considered lower intensity. Now, what confuses people is that actually some people use a 5-zone approach. I think some maybe even a 7. So I think it can become confusing, but generally we would be looking at low intensity work, making up the majority of people's training. We hear about world-class athletes doing 80% of their training at low intensity and just 20% at high intensity. And that's often something we share with runners because they think it's the other way. They think, I've got to work hard in every single session. I've got to push 100% in order to be fast. But actually, that's not really true. What we want is volume first. And then with that in place, then we can start thinking about building in some intensity. But that might just be one good quality session a week. That may be really what it boils down to.
Yeah, and I think that's the general thinking. They think they have to start running and run a little more every day and run a little faster, and that the injuries all happen.
Yeah, I mean, and I've made that mistake myself. This is going to sound quite funny to the listeners, but I actually used to hate running. I didn't like it. And the reason why is because I used to just think, I've got to get this over and done with. So I just used to go out, get it done as fast as I could. It would be horrible because I was just really going for it. And I'd finish and I think, thank goodness that's over. I don't have to do that for a few days. And I just didn't like it because I was just doing every run too fast. And this was many years ago before I knew more about running. But then I started to realize, well, actually, if I'm going to train for a marathon, I can't do that for a marathon. So the marathon training plans have you running slowly. And that's where I fell in love with running, going out at an easy pace, a pace where you could chat to a friend and just enjoying it, the scenery, exploring places, running with friends. And, so I know myself, it's easy to fall into that trap of thinking everything needs to be hard. It's not the case.
Okay. And what is considered a large volume?
Well, that's going to be individual specific, but my understanding is that the elite distance runners might do 160 to 220 kilometers per week.
Okay.
Whereas we might expect an average runner to do perhaps quite a lot less than that. Somewhere around that 40 to 50K a week is quite common, but of course some people will be less than that, some more. This big study from Muniz Pomares et al., I think they had runners on average doing about 3.6 runs a week was kind of the average. So I'd say it looks like many runners, probably from my experience, run 3 or 4 times a week. But it will be quite a lot of variety. The key thing is it's about the individual. So it's where are they now and where are they trying to get to that's probably more important than setting a figure, if you see what I mean, so that we can gradually build up any aspect of their training.
So the volume is more related to the distance. So how long the distance that they run on that week?
Yeah, that's right. So we would typically monitor if someone's running weekly mileage is a nice measure of volume, weekly mileage or weekly kilometers. We might track training time. So that can be useful if someone's doing a number of different sports. So, let's say you've got a triathlete, they're swimming, cycling and running. It's hard to compare distances across those things, particularly swimming versus running, very different in terms of how much you'll cover. So we might say, yeah, let's track distance, but let's look at total minutes across the week. And if you want to monitor intensity as well, you can get people to score their session in terms of effort. So 10 out of 10's maximal effort sprinting, 0's no effort. And that can allow you to monitor the intensity of each session as well as the volume. So we would often do a bit of both, particularly if we were really wanting to monitor quite closely for someone if they struggled with return to running.
And then in the intensity, that's the part that you said that should be 80% on the the easiest aspect, and then 20% going on like a higher intensity?
Yes, that's right. So, you could suggest that then that probably most of their training volume is going to be at or below roughly 4 out of 10 in terms of effort.
Mm-hmm.
So that's just a rough guide. There's different opinions on that, but that's often what we would tend to use for runners, because if anything, they'll want to work harder. So we want to try and make sure most of their training is at a pace they can chat, they're comfortable with.
Mm-hmm. And is that a subjective measurement, like what they perceive their effort is?
It is. Yeah, it is. And that's where, we said at the start, when it comes to training planning as a physiotherapist, I think we want to be aware of what our role is and when we need to work with others. So I think when we're guiding people back to sport and activity, we do want to understand training plans so that we can bring them back into that activity. We also want to understand a bit about training and which errors people might have made in getting an injury, so we can prevent those things going forward. But when it comes to planning training, particularly where there's a high performance focus, that's where I think we really do need to team up with a running coach. So if people are listening in and thinking some of this sounds a bit complex, I'm not sure how to do this, team up with a running coach.
Mm-hmm. Yeah, absolutely. And how about the strength and conditioning?
Yes. So we know that there's some good evidence that strength and conditioning can improve running performance. So, just to recap our pyramid, we've got that consistency, recovery and fueling at the bottom, volume next, and then the next layer up is intensity and strength and conditioning. And what we see from some recent research is if we're doing heavy strength and conditioning, so typically it's going to be at or above about 80% of 1 rep max, and we're combining it with plyometrics, that's thought to, again, be particularly useful for improving running economy and performance. So we know it can help. There's also some evidence that running injury risk may reduce with strength and conditioning. From recent work found that hip and core exercises may reduce running injury risk. So it can be a win-win for our runners.
Yeah. So do you recommend people doing like heavy resistance training, or like is it a mix, or how do you go about that?
Yes. So, first of all, we've got to remember that we're seeing people with injuries. That's the thing. So our focus is on treating injuries rather than, I don't necessarily see healthy people without injuries. So with that in mind, our strength and conditioning has to be tailored to their injury, their healing processes, and their pain. So that's something to bear in mind with it. So typically, we're not necessarily going to start super heavy because that will be provocative for their symptoms. So we may start at a low level, really finding something that's very tolerable and manageable. And then as their symptoms settle, then gradually we ramp that load up over time until perhaps we're getting to the end of the spectrum where we're more likely to see performance enhancements. And it's a bit like that when we're talking with a running coach. As we move more towards a performance focus, that's where we might bring in a performance professional like a strength and conditioning coach to get the benefits from their guidance.
And it's more likely that they're going to be working on that stage probably with the athlete.
Yeah, again, it depends on what the priority is for the patients. When they come to see us with pain, once that pain's been addressed, they may want to focus more on performance, and they need to see the right people to help them do that.
Yeah, absolutely. And then moving on to the top of the pyramid.
So the tip of our pyramid, like the cherry on the cake, is gait retraining. Now, the reason why that's kind of the last consideration is because, again, you want everything else in place first. We've got evidence really that each of these things we've discussed so far is going to be important for performance, but there really isn't a lot of evidence that changing someone's gait actually makes them run faster. That's the problem. And any change that you make to running gait takes effort. And that comes at a cost. So we might think, we'll suggest you change this and this, but actually it's made more effort. So it's actually making them less efficient. So I would say get those other things in place first, all the things we've discussed so far. And then there might be a smaller role for gait retraining. But I think most runners, getting them back training consistently at good volumes and recovering well is going to do much, much more than trying to tweak their gait. Personally, that's my opinion.
Mm-hmm. And how often should running and rehab be incorporated into a weekly plan?
Yes, great question. So if we're trying to bring this all together for a runner, and they're at their stage of recovery where they're ready to start introducing some running again, I usually go with a weekly plan that I call a 3-2-1 approach. It's easy for us to remember, and it works really well. So the 3 is we usually have 3 runs per week. That gives us that consistency. We're loading the tissues regularly to stimulate them to adapt. But it also means you can have a non-running day between each of those runs. You don't have to do back-to-back run days. So you 3 runs a week. Your 2 then is your 2 rehab sessions a week. And we're typically going to put those on non-running days. And then our 1 is 1 dedicated recovery day per week. Now, you might choose to have more than that, but by having 1 day dedicated to recovery, we know we've got it planned in every week. And we might, for example, think, okay, let's put that in on, say, a Saturday if they want to do their longest run on a Sunday. So they're nice and fresh and ready for that longer session. Now, this 3-2-1 approach leaves you a spare day. And that allows us some flexibility. So let's say the runner's really struggling with fatigue of fitting everything in. We make that spare day a recovery day. So we get an extra recovery session. Let's say they want to do a bit more. They want to do some higher intensity stuff, but they can't cope with it in the running. We might say, okay, let's do a high intensity cross-training session in that spare day. Let's get you on the bike, say, and use that to give you that high intensity work. If you can cope with it, this is key. The idea is this all should be manageable. If you feel like they haven't quite hit their strength and conditioning needs yet, that spare day could be an extra strength and conditioning session. So there's lots of flexibility in there, but really the emphasis is on, first of all, find something manageable that doesn't irritate their symptoms.
Mm-hmm. And since you are mentioning the cross training, so what role does that play in your your approach with your patients, and when do you recommend it, and what do you usually suggest?
Yes, so cross-training is really, really useful because it can help to maintain the cardiovascular fitness. It can help them get a lot of the mental health and physical health benefits from exercise, but it loads tissues in a different way. It can be a way that we can help keep up some training volume too, even when they're not able to run. The thing is, we want to follow the same guidance in terms of pain. So there's no point replacing painful running with painful cross-training. It doesn't really do much good. Now, as you know, with running and most activities, we tend to say it's fine to continue for most patients if the pain is mild during, so up to maybe a 3 out of 10, and settles quickly afterwards. So it's down to baseline normal levels within 24 hours. So we'd look to try and do the same with cross-training, follow those same guidance. There is one important exception to the rule for listeners to know about, which is bone stress injuries. We like to keep those pain-free throughout, so both during and after exercise.
That's interesting. I was listening to one of your videos on the YouTube, and you're talking about how that injury is different, that you have to remove all the stress, right? So you're not stressing the bone.
That's right. We were really, we really want it to be pain-free during loading for bone stress injuries. They don't do very well if we keep loading into pain. That is right. But if we think that through with cross-training, it is often weight-bearing the impact that irritates bone stress injuries. So if you replace, say, running with something like cycling or rowing or swimming, for most bone stress injuries, that would be quite comfortable. But of course, it depends on the site of the bone stress injury. So, always will be individual specific, and a decision's got to be made by the health professional with that individual patient.
Mm-hmm. Mm-hmm. And usually, do you use more bike in general, or it varies a lot? Like you said, could be swimming, could be rowing.
Bike's really versatile, definitely. So bike does get used a lot, but there are things that will be aggravated by sitting. So proximal hamstring tendon pain often really is quite irritated sat on a bike or a rower. So we wouldn't usually suggest that. Some patients with patellofemoral pain or irritable iliotibial band syndrome will also find the bike a little bit irritating. So we can talk generally, but it always will come down to the individual specific patient. Sometimes a good strategy can be arms only cross training. So if there's nothing they can do that doesn't irritate their symptoms, or it's not safe or appropriate for them to do things like cycling or rowing, then we might say, okay, well, let's do an arms only session in the pool with a pull buoy between your legs, or you can even do arms only on the rower. You can do battle rope sessions. You can do those kind of cross-country skiing machines with just your arms. So there's lots of stuff people can do if the patient wants to. So don't feel, people listening, that you've got to give every patient a huge list of stuff to do. I would see it more as options. If they want to cross-train, this is the kind of stuff we will discuss with them.
And they usually replace that for the running sessions, or maybe once a week, or if they are in that case that they need cross-training, it's just like they're not running at all and they're just doing cross-training, or you just want to relieve some of the load. So what is the rationale?
So how much cross-training they tend to do will obviously depend on the specific situation. So if we have a look at some examples here, let's say you've got someone who has very irritable symptoms. They can't tolerate any running at all. Even a minute is just stirring them up and it's too sore. But they said to you they really want to continue some cross training. They want to maintain their fitness, and it's important for them. So we might try to replace as much of their running as possible with some cross training, because that's important to them. So it may end up being, all of their running potentially is replaced by cross training, or that we look to see what's a manageable amount they can do in terms of this based on symptoms, even if it's just 40 to 50%. We've got another runner who can manage some running, but they can't quite do everything they want to do at the moment. So in terms of distance, say, we might say, okay, let's top up them. So let's say at the moment you can manage about 20 minutes of running, but you want to do 30. Let's do 20 minutes of running and 10 minutes of cross training to top you up to the type of volume that you want. So a lot is about kind of working out what can someone cope with, what do they want to do, and where might we be able to bring in cross training that doesn't aggravate. And sometimes it can be just a specific session. They might be happy with their training volume, doing the distances, but they can't cope with intensity. So let's have a high intensity cross training session if that's more comfortable for their symptoms as a replacement.
Okay, yeah, makes sense. When I was an athlete, I used to do artistic gymnastics, and I was always injured. Like I broke every single part of my body. And at some point I had a competition, and then I was just going on the bike and not really training in any of the apparatus. And then like on the competition day, it was fine. And everybody was like, I want to do bike too. That's working.
Yeah, absolutely. Yeah. And we see that with triathletes. So quite often we'll get a triathlete come in and see us with a running related injury that isn't painful when on the bike or in the pool. So, we'll then often say to them, okay, well, let's keep the bike and pool going, because that's comfortable for you. Your body's used to that. And quite often that allows them to maintain the fitness, and they might have an event that's coming up like a half Ironman where they actually haven't done that much running whilst they were calming something down, but they often get through it really well. So yeah, that does work. But I think one other little point on the cross training is to just bear in mind what someone is used to for their body. So, for example, in that first situation, we said, well, we could replace all their running with cross training. Now, if someone's very rarely on the bike and you say, right, you're going to do 4 hours a week on a bike, they're going to get sore because their body's not used to it. So always with these things, I keep in mind is a reasoning process that we adapt with each individual, as opposed to rigidly thinking this is the way.
Then you might develop other injuries on the bike doing 4 hours.
Yeah, absolutely. Certainly you'd expect them to get a bit saddle sore if they're not used to it, So much of what we do as health professionals is individually judging what's appropriate for the patient in front of us for everything, assessments, treatments, return to sport. It's all got to be done individually.
Yeah. And so how do the pain and the injury influence on the treatment plan? So how do you deal with them?
Yeah, so we've talked a little bit about that in terms of how we might try and make sure that the pain is minimal during and settles quickly afterwards, or pain-free with bone stress injury. Often what we've got to try and factor in is how can we do the rehab alongside the running. And that is a challenge. So quite often keeping those rehab days and running days separate works quite well. And knowing what activities are more likely to irritate certain pathologies, that helps us to plan it as well. So if we give you an example, if we think of an insertional tendinopathy, so you think about the Achilles, for example, where the tendon inserts to the calcaneus. Those types of tendinopathies are usually really irritated when the tendon's loaded in a stretched position, particularly if they're doing rapid, like plyometric activities. So, for example, with that, if that's a runner, we might say, okay, let's cut down your hill running, because that is going to be loading you in dorsiflexion in a stretched position. It's going to be challenging for the calf and Achilles. That's the kind of thing we're going to want to try and change. We might also say, let's do some calf work, but not off the edge of a step, because you're loading in a stretch position. We might also think about footwear having a larger heel to toe drop. So again, there's less stress around that Achilles. So those are the kind of things that we factor into the program. Now, staying with tendons, they don't tend to like back-to-back run days. If you run Monday, Tuesday, Wednesday with a tendon, it often really irritates it because it can't cope with that. So that's where those recovery days in between are part of that process with the tendinopathy. So hopefully people can see how we're kind of piecing it all together a little bit with each athlete, layering in a little bit at a time.
Mm-hmm. And then I remember watching one of your videos about rehab exercises. So you mentioned like a few exercises that you usually like to use. So do you have any tips for us? Like what should we be thinking about when you're rehabbing a runner?
Yes, absolutely. So I think, first of all, it's got to start with that good assessment. That's really important. There's so much stuff out there for runners that's very generic. That lots of all runners should do this or all runners should do that. So it's got to start first of all with a good assessment. And in that initial session, really trying to see, can we find out what is a manageable amount of running for this runner at the moment? Because that's a really good start point. So many runners, when you talk with them and you explore it, you'll be able to find that there is a distance they can cope with at the moment. So I think one of the first and most simple things we want to do is see, okay, well, can we find that? Let's say it's, for one runner, it's 5 miles. Can we find that? Okay, so you can cope with 5 miles pretty comfortably, but above that's uncomfortable. So let's start by making a program around that. And that could look like saying, okay, your longest run is 5 miles. You have a shorter one at 4 and a shorter one at 3, and let's see how you get on. Now, before we complicate it and add anything else in, just getting that in place where we've got some training going at a manageable level, I think it's a really important treatment strategy. And I would often look to get that in as a priority. And then we can start thinking, okay, you're coping with that. Can we layer in some other things as well now? So we can bring in rehab alongside that if they're coping with that. And we can look to find a manageable level with their exercise. And it's a similar process. If you bring in rehab exercises, if you start by establishing what's manageable, you can always progress to what's challenging. You can always add load. But if we start too high and irritate everything, we're spending most of our time to calm it down. So I think that's kind of an important process. If you've got those two things right, running at a manageable level, rehab at a manageable level, and then progressing, you're going to do pretty well.
Mm-hmm. And when you are talking about the manageable amount of running, you're always trying to keep them running. Like that's the first question when they come, like, can I continue running? Like they don't want to stop, right? So that's why you're saying to try to find a manageable amount to maintain them motivated and running and coping with the treatment too.
Yes, if it's safe and appropriate for them, yes. As we've touched upon, it's always going to be individual specific. We're going to need to be aware of more high risk injuries, so bone stress injuries, and certainly stress fractures. We're going to be very cautious and careful with those. And there are injuries like that will need a period of time to be off, to be healing, to be recovering. But there are a lot of running injuries, typically things like patellofemoral pain, things like Achilles tendinopathy, where actually there is a manageable running level of running that we can get people to find. So if that's the case and we can safely get them to do that, yes, we would try and keep that going if it's safe to do so, because we want them to get all the physical, mental health benefits of running. They love running. If there's a manageable amount they can do, it doesn't really help to stop them. And because you've got to bear in mind at some point they've got to come back. And that's when they'll pick up another problem, when they're starting to build again.
Mm-hmm. And when you say manageable, do you have like a number, like a perceived, like maybe a pain level on the next day? So how do you measure that?
Yes, so it's like we were saying before. For most injuries, we use a pain scale up to 10, and we say so if 10 is the worst pain, up to about 3 out of 10 is usually okay in terms of pain during running, as long as it settles quickly afterwards. So it's back down to your baseline level within 24 hours. But with bone stress injuries, that we want really to be pain-free. So pain-free during the running, pain-free afterwards. And, we test quite carefully with bone stress injuries to see if they're ready to return to running before we do that. So, we have to be more careful with those.
Since we're talking about those, do you, like when you're treating them, other than removing the load, what else could we do to help those people?
Yeah, that's a brilliant question. I think with bone stress injuries, like with many running injuries, there's a bigger picture. Like we want to think what is influencing bone health for this individual. Now we know low energy availability is a big piece of the puzzle. We talked about that earlier in the podcast. That can be affecting bone health. So, in those early sessions with someone with a bone stress injury, we'd be asking about those things. So, is anything influencing their bone health that we can address to help them come back in? And if we're concerned about low energy availability, as we said, involving a registered dietitian, we may refer to a sports physician or other members of the team to check out why they're having these bone stress injury problems. Also, with those bone stress injuries, we look to see if we can find a pain-free level of loading. So that might be cross-training potentially. It might be for some. Sometimes there will be some pain-free stuff they can do. In a low-risk bone stress injury like medial tibial stress syndrome, we may be able to find a pain-free level of running to continue with, but we would want to keep it pain-free. And then we will usually include some strength and conditioning, because that also stimulates not only the muscles to be stronger, but the bone as well. So there's lots you can do for bone stress injuries as a physiotherapist and a health professional. But again, it's worth teaming up with others if it's a complex case.
And then on the strengthening aspect, what we usually do is the ankle far away, that type of thing. Would you do that as well?
The what? Sorry,
do you know ankle far away? I don't know if they call it another way. The dorsiflexion with the band and the resistance, the plantar flexion, dorsiflexion, eversion.
Oh, I see. Yes, yeah. So yes, you can do. I think when we're thinking about the main muscles in runners that do most of the work, it's usually the quads, the calf, the glutes and the hamstrings. So yes, we can strengthen up around the foot and ankle. That does have value, but I'd probably want to include some weight-bearing calf work, because that's going to load the bone and the muscle to strengthen it up. I probably want to include some weight-bearing quads work, like squats or single leg squats, that type of thing. Some work that's going to strengthen around the hip, like deadlifts and single leg deadlifts potentially. But all really emphasizing pain-free and at the right stage of recovery for these bone stress injuries.
Mm-hmm. Okay. And then would you like to talk about any other like specific exercises or things that you recommend our physical therapists to think about when they are rehabbing?
For just generally in runners, or for any particular condition?
Maybe you can talk generally, and then if you have time, maybe pick a few more conditions.
Okay,
What do you think?
Yeah. Yeah, absolutely. Um, yeah. So again, obviously it's going to be individual specific, but I think if you're trying to target those key muscles we've just talked about, then some good simple things that people can do would be things like step ups and loaded step ups. They're very good at challenging glute med and glute max, and most people have access to a step. So simple thing that people can do at home. Calf raises and loaded calf raises also very good because, again, easy to do at home, can be progressed quite easily with weight in a backpack. For things like the hamstrings, I think bridges and bridge variations, again, progressed with load, can be really useful for challenging the hamstrings. I think stuff like your single leg and double leg deadlift can be good. I also like balance work for runners because a lot of them struggle with balance work. So things like single leg balance and single leg squat motions, putting them on unstable surfaces sometimes, particularly if they're out there on trails and slippery surfaces and things like that. And also plyometrics can be very good. So that can be, simple stuff like bounding, squat jumps, box jumps, hopping. All of those things are very useful for runners to develop power. But with all of these, the best thing to do is base it on an assessment. Where do they need to focus their work? What are they ready to do? What are their symptoms going to allow them to do? That's obviously going to underpin everything.
Yeah. And sometimes people ask us for advice, right? So like they want to start running. If someone that wants to start running and comes to ask us like, what should we do? Like in terms of strengthening. So like to prepare the body for the activity, all of those things that you just mentioned, would then be useful for a person that's no injury, pain-free to start doing before they run?
Yes, yeah. Potentially. Although the jury's out a little bit on how helpful that is, and how to go about doing that. I think it's useful to prepare the body for running, but I think the most important thing people need to do when they start running to begin with is go slowly. And I think the problem is that people, they rush into it. Especially, we had this a lot during COVID and during lockdowns. There were people that hadn't run for years suddenly doing 10K a day because they're motivated and they want to get fit and they've got all this time. They had all that time at that particular period, and they just go for it. So probably the most important thing, again, it's the bottom of that pyramid. It's consistency. Yes, you can do strength work to prepare the body, and I think that's valuable. But if you're consistently running at a manageable level as a beginner, and you're gradually and consistently building it up over time, and you're recovering well and you're fueling well, that's what I would say is more important. Because one of the things we've got to bear in mind with strength and conditioning is it creates fatigue. So trying to juggle that strength and conditioning with building up running at the same time is quite hard for people. So sometimes we have to focus more on one area at a time.
Mm-hmm. Yeah, that makes sense. And so what would be the most common injury that you see with your patients?
The most common injury that we tend to see in runners is patellofemoral pain. My patient list is slightly different because I've published research in tendinopathy. I see a lot of tendon pain in patients, so that's probably more common for me. But yeah, patellofemoral pain is the biggest one for most runners.
Mm-hmm. And then, do you have any recommendations? Now we're gonna try to quickly. I know we could do the whole podcast just about that topic.
Yeah.
But if you have maybe like a few tips of like things that sometimes we don't pay attention or that we should be doing, strengthening this or that on like patellofemoral pain, for example.
Yeah, absolutely. So for people listening in, health professionals that want to know more, there's a really good best practice guide by Brad Neal and colleagues, really good. It's just been published in the BGSM that talks about best practice generally for patellofemoral pain. So we know in particular from that that knee-focused exercises are probably going to be the priority for a lot of people, and that's very true of runners. We know the quads are important, so we'll often want some knee-focused exercises for the runners. So that might be things like your squats and squat variations, your leg press, your seated knee extension, those kind of quad biased motions. The challenge is when someone's got pain is we might need to adapt that so it's not irritating. So let's say you've got a runner with quite irritable patellofemoral pain. We might start with shallow squats because the load on the knee is less when we're not going into such deep knee flexion. Similar with the leg press, we might start in a smaller amount of knee flexion, maybe up to say 60 or 70 degrees, if that's all the person can cope with. So you can adapt the load, you can adapt the range for those to make them manageable. Second on the list, again, probably from Brad Neal's work and what we see tends to work in runners would be hip targeted exercises. Now they have the advantages of having generally quite low load at the knee. So that might be things like your side lying hip abductions, your single leg bridges, your hip hitches, maybe even to some degree things like single leg deadlifts if we're not bending a lot of the knee, or deadlift variations. Maybe to some degree step ups, again, if most of the motion's happening at the hip. So there's quite a lot of ways we can do hip focused stuff to strengthen particularly the glutes, to some degree the hamstrings, that is less likely to irritate the knee. So we might mix those in. So just thinking of an example program that we might have might be something like squats to hit the quads, some single leg bridges to work the hamstrings, and some sideline leg lifts to work the glutes. That might actually be a program I'd send a runner away with. Just those three, but trying to load them at a level that challenges them in terms of effort without irritating the symptoms. So staying with those same pain guidelines we've already talked about, not pushing beyond 3 out of 10.
Okay. And how about the paper that you published that you mentioned about tendon? What was that about?
Yeah, so the main paper people might be familiar with is in 2016, we published a paper on proximal hamstring tendinopathy. So it's a narrative review of the assessment and management of hamstring tendinopathy. So we talked through various stages of rehab for the hamstring tendon and how we adapt training and everything else like that. So yes, that's why I get so many people with tendon pain coming to clinic.
That's awesome. And what happened? Like, what was your interest specific on tendons? Why did you decide to do the research?
So I had hamstring tendinopathy. I had proximal hamstring tendinopathy myself. As a runner, I did far too much hill training. And that then really irritated it because, again, we've got that combination of compression of the tendon alongside, the hamstring working hard to drive you up a hill. So I developed that condition a long time ago now. And at that point, I looked around and there wasn't a lot of guidance out there for us to rehab it. So I felt a bit in the dark about how am I going to rehab my own injury? There's not really much out there. So then I started to look into, the research in tendons, the research in hamstring exercise, and really delve into how we might address it. And that led to writing a paper with I was very lucky, I had some really nice co-authors that were very supportive. And we developed that paper together. Yeah.
That's awesome. And any key points from the paper that you'd like to share?
Yeah, so I think one of the key things with it is that it is that compressive load that's a key part of what we're trying to manage. So that compressive load of the hamstring tendon, the proximal hamstring tendon, will occur when we're loading with the hip flexed or when we're stretching the hamstring muscle. So that really tends to irritate it. So what quite often happens is someone with hamstring tendon pain goes to a health professional and they say, stretch the hamstring, stretch your glutes. And it just irritates it. So a big part of what we talk about in that paper is, first of all, trying to reduce that level of irritation to let it settle, and then using a progressive rehab program to restore strength. And the way we progress it in the program is we talk about, in the paper, starting isometrically and starting out of positions where there's compression of the tendon. So very little hip flexion, very little stretch. So we start isometrically, and then as symptoms settle, We move on to dynamic work, but again, with very little hip flexion. And we progress that by adding load. So typically we might start at roughly 15 or 12 rep max and gradually progress through towards 8 rep max, maybe a bit higher, 6 rep max sometimes, depending on the patient. Now, what that usually does is restore strength and improve the tolerance to load so people can cope with more activity. And then the next stage would be for us to potentially add in loading into slightly more compressed, challenging positions. So we start to introduce a little bit more hip flexion into activities, a little bit more stretch around the tendon. We often balance that by reducing the load a little bit. And then the final stage is to start to bring in plyometrics, because that restores power to this process. But people are probably picking up on the fact I keep saying it's got to be individual specific, and it does. Everything we do comes down to the individual. So that would be the case with this program. Some people will come in at stage 2 or even stage 3. Sometimes they'll be ready to do more advanced stuff if their symptoms aren't very irritable. Maybe they've rehabbed a bit already. Some patients will be so irritable that even isometrics we have to be careful with. So some people, I'll start with them with a 5-second hold with the lightest possible weight because that's all they can cope with. So I think that's so key that for people to have in their minds. It's the same with our suspected bone stress injuries. Some of them will be at a comfortable stage. They might be ready to start loading. Some, if they're struggling with weight bearing, we don't want to do any impact with them at all because it can be provocative. It might not even be safe to do so. It might not even be safe to test it in someone if you really suspect a high risk bone stress injury. So a lot of that sort of judgment that we need for every part of assessment and treatment, really, what's safe and what's appropriate.
Yes. And what's the name of the paper so we can... Do you remember from the top of your head?
Okay. You're testing me now. I should remember it's my own paper. Hang on.
You can send me later. I don't want to put you on the spot. You can send me that. I can add to the show notes.
I've got it here somewhere. Let's have a look. Proximal hamstring tendinopathy, clinical aspects of assessment and management. So it's a bit of a mouthful, but yeah, bit of a mouthful.
No, that's awesome. I'm gonna add those to the show notes so people can go check it out and see in more detail. Tom, any other injury or things that you wanted to mention, or any special tips that you think it's a must know for our listeners before we go to the final questions?
Yeah. So one final point with this is that, we've talked a lot so far about, training planning and exercise and stuff, which is great. It's so important to what we do. I would just have a bit of a think as well with your people you're working with about what are the drivers for their training and the beliefs behind why they're running the way they are. Because sometimes I think we all find this as health professionals. You might say to someone, I recommend you reduce your training a bit. And they come back a week or two later and they haven't. And we're wondering why. Why haven't they? And we might say again, I think you need to reduce your training because it's irritating everything. And they come back and they still haven't done it. And quite often the reason why is because there's a driver there that we haven't identified, a belief that's for them that's making them train in a certain way. And that's what we then need to get at. So if you're working with someone and they perhaps seem reluctant to change their training, have a chat to them about it. Ask them why they train the way they are. Ask them why they might be reluctant to cut down. What are their concerns? And that then opens up a really good conversation to start to see, oh, okay, right. Let's get into that a little bit. Let's try and work out what that is. Let's problem solve it. So we've had things like we've had a guy who was going out running with his daughter. She was back from university for a short period of time and they like to connect by going out running together. So that was their kind of shared time, which I think is really special. So we're then saying, well, you've got to cut that down. And understandably, it's really, I don't want to do that. I love that time with my daughter. So we're then saying, yeah, no, I can completely understand why you wouldn't want to cut that down. What can we change here? Would you mind doing some of it on a bike? Could you cycle alongside and chat as you go? And then he's like, yeah, no, actually, we could do that. Okay, well, could we try that? Could we replace some of that with a bit of bike where you still get that nice time together, you still get to do the training, but it's not going to be so irritating. So it's just trying to find out those drivers sometimes that I think that are important.
Yeah, and I think a lot of those beliefs that if they run less, or they reduce the volume or the intensity, they're not going to be ready to whatever they are preparing to do. And sometimes I understand that slowing down and healing, it's the best option for them. So
100%.
very important. Yeah.
100%. And quite often what people do is they focus on those things higher up the pyramid and sacrifice the things at the bottom. So they focus on working really, really hard, but then they keep getting injured, so they can't be consistent. Whereas we think the other way around, focus on being consistent, add in some intensity work to boost your performance. Don't sacrifice the consistency to push hard all the time.
Mm-hmm. Yeah, it's so common because I have a lot of people reaching out. I start running and now this hurts and that hurts, and they don't understand why, because they keep just adding on. And now if I run 15 minutes today, I want to do 20 tomorrow, and they keep going and just adding up without any guidance or
That's it. That's it. And that's part of the issue. That's why we want to know about planning as health professionals. And it's going to be really different sometimes. So we'll have some patients that come to see me that haven't run for, say, 2 years. It's quite a regular situation where I have a patient that comes in and they'll say, look, I've reached a point where you're my last hope. I've tried everything. And every time I try and get back to running, it really flares up my symptoms and I have to stop. Now, with those patients, we will do rehab and stuff. We'll do a variety of tests to check if they're ready to return to running. So we've got a whole testing process for that I would encourage people to learn about and do. And then when they're ready, we start with a minute run, a minute walk, and maybe do 2 or 3 reps. And that's it. So we're looking at maybe 2 or 3 minutes all together. And then we test that for a couple of runs to make sure it's well tolerated. And then we add 1 more minute. So for those patients, it might take us 5 or 6 weeks to get them up to 10 minutes of continuous running. But that's the hardest bit, like getting to 10 minutes, because then you can build a little bit more quickly up to 30. And we'll get those people back into running successfully. But it's in that situation, it can be incredibly slow and gradual progression that's needed. And in other situations, you'll have someone that's already coping with 5K, and you might be getting them up to 10K then in maybe 5 or 6 weeks if they're ready to. So it really will come down to sort of planning a way that works in that way, really, if you see what I mean, for that individual.
And in your experience, do you think a lot of people work with running coaches, or most people just start out of their own heads and I'm going to start running?
Yeah, I think most people don't. And I think most health professionals don't actually work with running coaches. But then the problem is a patient gets kind of stuck because the physio might feel like they don't feel ready to guide them on their training because they don't feel confident to do that, which I can understand. But the running coach might say, well, you're injured. I don't feel really confident to help you. And that's where actually quite often those two, the coach and the physio come together with the patient and say, right, okay, let's work this out together. And we do that with patients. We'll set up WhatsApp groups, work really quite nicely, or Zoom meetings or, email threads or whatever works for those particular individuals. And when they're first coming back after injury, we might be going run by run. So just check in, send me a quick message or a quick email after this run. Just let me know how your symptoms were the next day. So we can then check in with them and say, right, let's tweak that a little bit. That's been a bit too much. It irritated you near a bit. Let's just go a little bit less next time. So it often takes that process of, initially going run by run. And then when right, consistently you can manage this. Now let's work with building you up a bit more.
Mm-hmm. Yeah, that would be so important to collaborate with a running coach that has that knowledge that we lack and they don't have the knowledge we have.
Absolutely. And because they've got that performance focus, I've had runners, healthy, non-injured runners approach me and say, can you make me a marathon training plan, like a 16-week training plan to get for a sub 3-hour marathon? And I'll say, well, no, because that's not really my skill set. I'm not performance trained. I would be happy to help you come back after injury, but for that specific goal, I've got a great coach I can recommend. And I think that's a good thing to have. Have a little selection of coaches in your contact book that you can say, right, let's get them on board.
Yeah, absolutely. And then you mentioned about tests to return to running. So like if people want to learn more about the topic, do you have any like resources, information that you recommend people go to like read and research?
Absolutely. So they can go to my website, which is running-physio.com. We have a short guide to return to running that's aimed at health professionals that can give them some more information as well that people can approach me for. We can share that with you. What I would say, just generally, some of the things we're looking out for. So we want people to have minimal pain day to day. So that shows us they're not irritable. So, they're climbing the stairs and moving about day to day pretty much pain-free. We want them to be able to walk half an hour pain-free, ideally, because that tells us they've got some load-bearing tolerance. And we want them to be able to jog on the spot for a minute, again, ideally pain-free, because that tells us that they haven't got any impact-related pain. Now, so if they're achieving all those, we also want to make sure that they're an appropriate stage of healing for that specific pathology or injury. So your classic examples would be bone stress injuries and stress fractures, but also think about ACL surgery. You've got to wait to a certain healing point before you can introduce that. So if they're passing all of those things, it's at the right stage of healing, then we might then say, let's do a test run. And the test run typically is, typically around 2 or 3 minutes, because we don't know about the delayed response. So sometimes runners will go out and 3 minutes will feel fine, so they'll push on to 3K, and then they get up the next morning and think, what have I done to myself? So we will say, do 3 minutes, check in with me afterwards, let's see how that goes, and then we can make decisions about whether they're ready to do more. If 3 minutes really stirs them up, okay, which it doesn't very often. If you've passed all those tests and you're at the right stage of healing, it usually won't stir them up. But if it does, we'll usually say, okay, we need a bit more rehab time. We need to settle symptoms down. We might check this out again in 2 or 3 weeks. If they tolerate 3 minutes really nicely and it fits within our pain guidance that we've said for them, then we might say, okay, let's look at adding to that and see if we can build towards your goal, build the consistency and all those things we discussed earlier, the recovery and the fueling.
Awesome. And any recommendations of resource of information in general about the topic, everything we talked, that you recommend people to go?
Yeah, there's increasingly some really good resources out there. I'm a big fan of Richard Willey's work. Rich Willey's done lots of fantastic publications, as has Brian Heiderscheit and JF Esculia. They've done a lot of really good research in it. Brad Neal as well, as I said, has done his guide recently in patellofemoral pain. So I'd encourage people to look out for those people, as well as people like Christian Barton. There's a whole list of researchers I could mention. But have a look at those. I really like as well, there's a podcast called Pod Chat Live. That's really nice. That's by podiatrists, another really good member of our MDT that we work with. So that's really nice as a kind of regular weekly update. And I've recently signed up to a newsletter by Amby Burfoot, which is also really nice for regular running related resources. So there's loads of stuff out there. I'd encourage people to explore and learn more to help you.
We had a whole podcast with Christian Barton about patellofemoral pain, so people can go check that as well.
Yeah, check that one. Christian's brilliant. I might have to have a listen to that one. I might have to dig that one out because he's very good.
Yeah. Great. And any advice to clinicians that are starting their careers?
Oh, that's a good one, isn't it? That's a good one. I think get a good grounding in the basics. I really think that's so important because we want to go for the complex stuff. We see all this snazzy stuff being shared on Instagram and social media. We want to do the stuff that looks complicated, but actually get the basics in place. And actually for many, many patients, they'll do really well. So that is stuff like load management and making sure their activities at a level they can cope with. These things like education and making sure they can actually understand the injury so they can manage it themselves. It's things like some kind of rehab exercises to build up their strength and their capacity. And also a graded return to whatever their goal is. That's so valuable but often we overlook it in favor of something that's a little bit more complicated. But those would be the things I would be focusing on if I was starting over again.
Mm-hmm. And I know you also have a course, right?
Yes.
So what is your course?
So I do the running repairs course, which we have the in-person courses, and we have an online course that's hosted by Clinical Edge. So that's for trained health professionals and physiotherapists, podiatrists, any trained health professional that's treating runners as part of their scope of practice, really. There's an in-person one and online as well. Definitely check that out if you want to learn more about running injury.
And what is your website again?
My website, running-physio.com.
Awesome. And if people want to find information about you on your website, right? If they want to contact you, is there a way they can find you?
Yeah, so they can reach out on Instagram. I'm running.physio on Instagram or via the website. They can reach me there. Happy to chat.
That's awesome. Tom, thank you so much for sharing all your knowledge with us about running. That's been awesome. And I think it's very helpful for me and all the other therapists listening to us. So I appreciate your time.
Thank you very much for the invite and all the great questions. I really appreciate it.